In healthcare, there is often too much information and not enough time. Here at the Melanin Initiative, we avoid TMI by breaking things down into language you can understand. We create a safe space for you to ask your questions and share a nursing perspective without taking up too much of your time. Today's a very special episode. We are joined by emergency medicine physician Dr. Ruby Long and the author of Love Letters to Patients. In this episode, we're going to hear from her about her journey into emergency medicine, the inspiration for writing her book, and then we're going to delve into the top 10 causes of death and disability with emphasis on overdosing and gun violence. If you're new here, welcome to the Melanin Initiative. I'm Dr. Kimberly Madison, a doctorally prepared nurse practitioner and one of your co-hosts here, along with Alicia and Geraldine, who send their love in their absence. We are a health literacy podcast. When we sell health literacy, we're talking about your ability to obtain information, to understand that information, and then to use that information to manage your health and advocate for others. It's our hope that by watching on YouTube, LinkedIn, or listening to your favorite podcast app, that you'll feel empowered to ask questions, educated on how you can manage your health, and confident to navigate the healthcare system. If you haven't already, please use this time to subscribe, thumbs up the video, leave a comment or two. It really helps the algorithm know that this information is important so that when people like you look for topics like this, we'll show up higher in their search results. Remember, this show is for educational purposes only. The opinions expressed here are opinions alone. They are not a representation of any of our affiliations. If you're experiencing a medical emergency, you should seek medical attention and medical guidance from your healthcare provider. If you're having a physical emergency, you should call 911. And if you're having a mental health emergency or you know someone who might be, you should call 988. Dr. Ruby Long, welcome to the Melanin Initiative.
Thank you, Dr. Madison. I appreciate the invitation, and I'm just so excited to be here.
And we're just so honored that you would allow us to share your journey and your book with our audience. And it's really a delight to be able to partner with a physician in this nursing space because we're really part of the same industry. And more importantly, we're part of the same community. And it's important for the public to see that we work very well together.
Absolutely. It is a team sport by all means.
Yes. So before we get into your journey and your book, tell us where you're from and where you live now.
All right. So I am originally from Gary, Indiana. However, this part of Indiana is northern, and we kind of affiliate ourselves a lot with Chicago. So the greater Chicagoland area is, I identify as my home. And clinically, I work in Milwaukee. And so the lake, again, Michigan, has just been following me my whole life. And that's what I got.
Oh, I love it over there. I don't think it gets enough attention. It's beautiful. It's gorgeous.
It gets cold sometimes. So when you tell people like, hey, school got canceled because it was -40 below, people just, their eyes are just in disbelief. One, that's even a thing. And two, like negative anything. Why are people going about their business? So you know how it goes.
And who do you identify as your family?
Oh, well, I come from the camp of the Ezels and the Longs, and in all honesty, my parents were kind of that last wave of the Great Migration. And so they're both from rural Alabama who relocated to the north at different times in their lives so that they could have better opportunities and honestly be seen as human beings. And so those are my people, the Longs, the Ezels, and they are my biggest cheerleaders forever.
That's beautiful. And so since you kind of brought it up a little bit and it's the elephant in the room, how many Black people are in Milwaukee?
Oof, I would love to be able to tell you the data exactly, but I can tell you that in Milwaukee, we are still very residentially segregated, not necessarily by law. However, there were restrictive covenants, particularly in the early 1960s, where we still feel the impacts of, community redistribution. And so when we look at it, the demographics really haven't changed. There are certain cohorts and communities that are within pockets. And so I wish that we could say that there were heterogeneous communities around, but really it's not. We have very homogenous sort of pockets in the community. And I think healthcare reflects that.
Mm.
And healthcare Um,
And for the communities of color that are there, are they closely knit, or do you still feel kind of isolated even within the community?
I think right now it's hard to speak for every community, right? And so communities of color look varied. Have some communities of color that are of Asian descent that tend to affiliate with one another. We have communities of color that are of Latinx descent that tend to communicate and affiliate with one another. And then we have Black communities, right? And I think, in all honesty, we have gender diverse communities that often are looking for homes and community. And that's often a challenge for many people.
Lastly, we're coming to Milwaukee for the weekend. What should we put on our agenda?
Well, you have to get a brat. You have to get, for those people that drink beer, you got to get some beer out there too.
Oh, okay.
Absolutely. There's nothing like the summertime and hanging out at the lake. So absolutely tap in. And some people call it the third coast in the United States because Lake Michigan is beautiful. And there's the opportunity to like literally boat, chill, relax, just get some blue space in, as they say, for your wellness. And that I think would be very helpful. And lastly, while you're enjoying your beer and your brat, maybe you'll enjoy a baseball game.
Oh, okay. Well, thank you. Do you go?
Not often, but it's a whole scene. Baseball is a scene, so it's good.
Okay. Well, thank you. You never know. I love that part of the country, and it's really surprising how much actually, I was quite surprised how much diversity I found in certain small towns, and they were just so nice and so kind, and lots of good food can be found.
Absolutely.
All right, Dr. Long, tell us your journey into emergency medicine.
Oh, well, I think if you, again, tapped into the EZELs and the longs, they would tell you, oh, when you were 5, you said you were going to be a cheerleader and a doctor at the same time. And so it's kind of like, oh, okay, maybe. But literally, starting to get towards the end of high school, thinking about what the next step would be. I actually was very excited about physical therapy and athletic training. I was fortunate enough to go to a high school where we actually had athletic trainers on staff that worked with our sports teams. And so my last class of my senior year was with the athletic trainers, taping and wrapping ankles, getting all the athletes ready for whatever their event or sport was. So that was really awesome. And I went into college thinking, oh, for sure, I'm going to do athletic training or physical therapy. But I asked a question. I was like, what do you have to do to be a doctor? And they were like, oh, just take these classes and then, the MCAT, and that's about it. And I'm like, really? And so I was like, well, I'm going to try. So when I enrolled in college, I was pre-med undecided. And then eventually looking at the curriculum, I was like, oh, you have to take a lot of science classes to, actually matriculate into med school. And once you get there. So I decided to major in biology with a minor in chemistry. And it worked out. And I got into medical school on my second try after getting my master's in medical science. So I just want you to know that the road may be bumpy, but it is not impossible, right? And so we have to find ways to bolster our talents that we can be our best selves. And after that, I think I kind of was a person that was very high energy. And so when it came to deciding like what residency I would choose, where I would go, I kind of liked everything, but some things not so much. So I realized that I'm kind of like a commercial or a video girl. And so I need to have conclusions in a short amount of time, a plan of action, let's roll. And some specialties, right? It takes 10 months to follow a pregnancy along. It takes years to watch research and pharmaceuticals develop and be implemented. I just don't have the personality for that. And so I love emergency medicine. I get a chance to see a little bit of everything. We may not have the definitive answer by the time a patient leaves my care, but we usually have a plan, right? And sometimes that's the best thing for me and for the patient, right? Is that we have a plan of action and that we're on a way to do something. So That really, I think, was my draw. And some people might tell you that I have commitment issues. And so, honestly, there are very few emergency medicine patients that we see year after year after year. There are some, and they are kind of like family and staff, but that's very rare. And so it is just awesome to always meet new people all the time.
I love how you described how you found your niche, right? And so, how you describe the other ones. I think that really kind of can just at least help students or people who are thinking about this, like how to kind of go about this and match their personality with the actual practice itself.
Absolutely, because you're going to be doing this for a while, ideally. And, you know, even I think for me, a person that has commitment issues, right?
Oh, you admit that.
Oh, I will. I
Okay.
will. There's variety, right? And so even within this emergency medicine, I don't always have to see patients. I can do some administrative work, research, blah blah blah. So really being clear on who you are, why you are going into medicine, and hopefully that will give you clarity as you navigate this path.
Wonderful. And how long have you been in practice?
Woo. Okay, see, I graduated from med school in 2006. So we are coming up pretty close on 20 years, right? So that would be 18 clinical years of work.
Congratulations. You want to shout out any of your schools?
Oh, I went to Indiana University for medical school. And so I truly value the Dean of Admissions there for trying to create an inclusive community, right? Almost 20 years ago. That was really helpful. And I then did residency in LeBron's hometown of Akron, Ohio, with Summa Health System. And I will forever love my residency director because he was the next cheerleader of my life that inspired me to be my authentic self, to show up, work hard, and follow my dreams. And for that, Dr. Michael Beeson will always hold a spot in my heart.
We love it. And for following your dreams, let's talk about your inspiration for writing love letters.
Oh, we have to get serious now because it is literally rage, COVID, that made me take this path. And so I will say that it was a gift to work in multiple communities at the start of the pandemic. Some of these communities were very rural, like with critical access sort of formats or resources, which means scarce, almost none. And some were very well resourced. So just to see the duality of like, I think I just saw the same patient, but I didn't have the same tools at either hospital, and the outcomes were so different. And then we started to lose my coworkers. Some of my mentors have died from COVID, they contracted it. There were other healthcare workers that literally suffered what we call moral injury, but it's ultimately their hearts were broken and many could not stay in the profession, and some have tried to self help in ways that have not been healthy, and some have even lost their lives through suicide, major depression, and things like that. So, of course, me being a high energy person, I kind of raised my hand and said, there are some differences here. What can we do about this? And so then that led to creating policy about crisis standards of care and trying to be equitable in the allocation of that. And so crisis standards of care are kind of like the disaster policies we follow when we know that we just will not have enough resources to maintain a sense of normality. And part of this was, how do we get the community engaged in these very tough decisions, right? Because someone will get care, someone else won't get care. And so if we're all kind of partners along this path, it will make a very hard situation somewhat more manageable. And then that went into, okay, well, here's your policy statement. Write a full paper on that. And so then there was literally this scholarly paper of implementing restorative practices for crisis standards of care. And from that, I still had more to say. And then comes the book, right? So I feel like I've done my thing where I talk to my peers. And in all honesty, academia, policy, law, implementation usually takes years and years and years to get things done. And I just felt like there were too many people that when I go home and visit my folks in Alabama or anywhere along that sort of I-65 pathway, we have hard conversations. And many of our conversations kind of have become the crux of the book, right? Like, if you knew certain information, would you act on it differently? And so, I feel like love letters is literally like my conversation to people to advocate for yourselves, just to know what questions to ask, what things to even look out for, right? On our best days, it's hard to remember everything. So, this is a tool that you literally can put in your pocket, book, and help people that you love.
Yeah, and that's where our missions align, right? Yours and our health literacy platform. And so we want to talk about the top 10 causes of death and disability that people will find within this book.
Oh, yes, no one is spared. In all honesty, I think many people know, right, about heart disease, heart attack, stroke. However, accidents, right? Overdoses and accidental deaths have come on the scene as a major factor in loss of life. And COVID, something that we never even heard of a few years ago, has become one of the top causes of death as well. And so I think there's a moment when we dive into the content of this book. Each letter gives people like a just everyday appearance of what that condition would look like, right? Is it pregnancy? Is it complications of pregnancy? Is it childhood trauma? What does that really look like in the everyday life scenario? And what things should I even think about? I feel like when I see people, it's usually not on their best day, it's usually unexpected. And so to ask people to remember all these things at a time when all they can think about is just the loved one in front of them is really challenging.
Mm-hmm.
Um, and so I hope that Love Letters kind of helps us have brave conversations together and models what respectful healthcare and patient engagement look like. And then honestly, have some real difficult sort of conversations too, right? Like there's some prompts in there about, well, now that you have cancer, how do you tell your loved ones that you fought a good fight and you'd like to live your life differently in the time that you have? Or how do you even raise the questions of what's important as you make this transition from a physical body to maybe a spiritual realm, right? All these little things are in there that I think many people don't talk about but are curious. And so, you have a moment to like peek in and get resources if you need.
Yeah, I really love this book because, for one, right, you're an expert in your area, two like 2 decades, right? And you literally see everything as it walks in the door. And what I'm hearing when you talk is what I experience in my own practice and amongst my colleagues is it's like we see people on those worst days and those vulnerable moments, and we just want to get to them sooner. Right? So that they have the language so it's not such a shock and trauma. It's really, it's medically induced PTSD is a real thing when people have these experiences. And so you're giving them the language from an expert lens and you're telling them it's okay to have these tough conversations. We know they're going to happen. Because a lot of times when we encounter patients, they're just shocked. They're just surprised this happened, right? And you're just letting it make it easier to like, this is something that's going to happen, but we can get through this. And this is how we're going to get through this and we're going to get through this together.
And honestly, there are some things that don't have to happen, right?
Yes.
So, example, right? We know cardiovascular disease is the number one killer of people in our country. However, if you smoke cigarettes, you have a couple of extra pounds around your waist, you do a little meth, you do a little coke, we know that you're setting yourself up for either stroke or heart attack, which can have huge implications for not only yourself, right? Being an able bodied person, able to come and go as you want. But what about all the people that depend on you? Or that might even like you. They kind of like the full person that you are, right? And when you have limitations on your physical or mental body after a medical event, that changes a lot for people.
Yeah, and yeah, that's something we stand on a lot. One, smoking cessation. That's a big thing Alicia likes to emphasize. But yeah, we just really love to empower the community on how much is within their control. Because a lot of times people will feel like they don't have options. When you present the options, they'll say, well, what choice do I have? And we love to emphasize that you actually have a lot of choices. And the sooner we can get you this information, you have even more choices. And maybe you won't see us in this setting.
Absolutely. And particularly, some things are just very time sensitive, right? So if you're having a stroke, if you're having a heart attack, every moment that healthy blood is not flowing throughout your body is a moment that you may never recover your full self again. And so it burns my soul when people take naps, when they know their body doesn't feel so great. And I'm like, you've been in this body your whole life. And the fact that you couldn't speak your words or move your arm, or that you're just sitting still pouring off sweat with chest pressure, you know those things aren't right, right? Taking a nap at that moment is not okay. Like, this is not something you walk off. And so those are the people that I wish we could grab earlier and kind of paint a picture for them, as to the benefit of showing up earlier.
Yeah, and that's why we love this platform and that we get to share it with you to make give people the language, right? Give them empowerment so that when they do encounter the system, they know what to do, how to speak up for themselves, know their rights, that they have rights, and that there are people on this side who actually do care. Because sometimes that gets lost.
Absolutely. Um, I don't know. I feel like there is still honor and passion in medicine, right? Like, um, there are people that are not in this profession for money. The
Yes.
money is always great, but it's not totally easy. Kind of what we do. Every place that you have an orifice from your body, oftentimes as healthcare providers, we engage in that. So we see some of the gross things, but also we see some of the most awesome things ever, right? Again, stroke patients are dear to my heart, and it just warms my soul when someone comes in, they can't move their arm, they can't speak, and they are terrified. They get appropriate treatment. And before the end of my shift, we are having a conversation, doing high fives, right? And I know that this person can go back to being an independent human being. And that is great joy. And honestly, part of me feels like it is the joy, that is the honor, that is the payment and compensation for being able to be partners with people and help them, for so many reasons, right? Financial, emotional, communal. Healthcare is still a really wonderful profession, and we just need healers out there that get it.
Beautifully said. So you have 10, your top 10 causes of death and disability in your book, and we've chosen to focus on two of them. The first one being overdosing. So let's talk about what that is and three takeaways for the audience.
Oh my goodness. Well, overdosing, you know, typically is not intentional. However, there are tons of medications out there. We call them narcotics or sedatives, that affect your brain and your heart as to how well they coordinate their rhythms of beating, as well as with your lungs and breathing. And so sometimes, people take pain medications to heal aches, recover from a procedure or surgery. And in the inappropriate dose, it will tell your body to stop breathing and, tell your heart to stop working, which can ultimately lead to death if not treated. For some other people, their bodies have become dependent on these chemicals that relieve pain. And so they find themselves with party pills, heroin, dope, or other sort of products that are out there, particularly in the street, to try to calm some of their symptoms and some of their aches. And those things that kind of come across from the street are not necessarily regulated. So who knows what's in there? And oftentimes people assume that they have a certain product and there are some bonuses added to it. And by the time they take their regular dose of whatever that substance is, they wind up taking too much and then their body stops working. Alternatively, right, for the people that use, we'll call them illicit substances, that use substances when they party or go out, by the time you have a couple of cocktails or some alcoholic beverages, and you do a couple of pain pills and maybe a hit of this or something else, or you snort or inject something, all of those chemicals at the same time combine and cause people to die. And so now overdosing is one of the top three causes of death within this country. And it's accidental in nature, usually. Um, Occasionally, we are seeing um, lots of products that look like candies and edibles per se. These things can sometimes fall down out of your pocket or out of your purse, or they're not really secured in a fantastic way. And then the little people that live with us, oftentimes children, they get a hold of these substances, and the dose that an adult would take and a dose that a child would take are two totally different things, and these children are dying. Or someone is caring for a small child, but they have all their pills that they just kind of keep around their house, and maybe sometimes the pills fall down, and then when that small child comes over to visit or play, they get curious and put it in their mouth, and then they overdose from those things. And of course, there's a growing cohort or a growing community of people that use substances like heroin, cocaine, and pills to cope with the stress of daily life. And since the pandemic, overdoses have gone from here, just skyrocketed. And so there are so many people that, again, are impacted by stress, strain, trauma, that then maybe don't have the best tools to manage those and go to illicit substances or pills to try to cope. Oftentimes, they wind up hurting themselves and sometimes overdosing in the process. And none of us are here by ourselves. Half of the overdose adults out there that have died from a lethal dose or of like fentanyl, a pill, heroin, or some other sort of drink out there, whatever the popular thing is now, right? 50% of the adults that die from overdose are leaving a child behind.
Mm.
What happens to those kids? Who's raising them? So
Yeah.
many different things.
Yeah, and that was a great example of something that when earlier you mentioned things are preventable, and that's a really great one. And you bring up a very serious topic when you talk about children, which is it's always focused on bringing attention to the vulnerable communities. Me, Alicia, and Geraldine were three Black straight women, and we want to always bring attention to people who aren't sitting at our table. And so when we think about vulnerable communities, children are one of those communities. I think a really important point you brought up is the mental health aspect that's associated with narcotics or pain medication, and that if people don't have those tools that you talked about to manage their mental health at home, then they do seek out other options that offer kind of that quick solution. But we also know those quick solutions come with a cost.
Absolutely. And I think one thing about it is, sometimes these crises, they come about so intensely, so acutely, so fast, people just don't know what to do.
Mm-hmm.
And over time, they get more and more intense, more and more frequent. And so if you've seen it once, you probably will see it again. And so to know that if you can just pick up your phone and dial 988 for the crisis intervention line to get some local resources or to at least help process what's going on, I think that is tremendous. People that lose hope, that feel that suicide is the answer, again, 988 is a great number to call to at least really process kind of why you feel this way. And hopefully, suicide won't be completed and resources will be provided. But again, 988 is a huge way for people to connect. If you're not a talker, you're a texter, you go really hard in the paint on your device, right? You can always text 741741, 741 to speak to a crisis counselor right away, or at least text and get some local resources that way as well. So 988, 988, 988 for people that like to talk on the phone, or for people that like to text, 741, 741. Right? We'll get you another person that at least is willing to listen and help you navigate the crisis that's going on at that moment.
Thank you for sharing that. We're going to add that to our little disclaimer that I did earlier. So yeah, that's really helpful, and I like that you repeated it.
Not a problem. But yes, those are the things that hurt me, in part because, overdoses happen in every age demographic. However, our youthful young adults who are just really getting started with their lives are some of the highest cohorts or communities of people that are dying from overdoses. And again, they're not just dying by themselves, they're leaving a whole community of either parents, siblings, and children behind that have to kind of pick up, honestly, some of the financial pieces if they were the primary breadwinner for that household.
Yeah, and so we have another big topic, another serious one, gun violence. At the time that we're filming this is the summer, right? So you're seeing that quite a bit, unfortunately. And so let's talk about what it is and the three takeaways for the audience.
Absolutely. So, um, some people call it gun violence. A lot of people, the scholars, will kind of call it firearm. However, any device that shoots what we call a missile, which is like impacted, high energy, explosive, encased in some sort of vehicle for transport, is essentially a firearm. So that's a pistol, a handgun, a rifle, a machine gun. All these things can cause, are considered firearms. And essentially, I, I will speak for myself, but I often thought that gun violence was affiliated with certain types of communities,
Mm.
communities that you would just drive through really fast. Don't stop there. If you get a flat tire, just keep going. But in all honesty, did you know that suicide is linked to gun violence or firearm use? So, more than half of the people that commit suicide use a firearm. When we think about firearms and guns, there are more people that take their lives through suicide with a gun than there are people that commit acts of violence to another person. And so I think we have to open up the discussion, right? These are very intimate, hurtful, harmful, personal topics that we're talking about. But I think so many people feel like they are in isolation, and um, many people result to ending their life to try to cope with the things that are occurring. And maybe, right, maybe somebody would realize that, oh, if I use this gun, this will be a permanent solution to
Mm.
be a temporary problem. And again, through using 988 or either 741, 741, there are options of hope out there, that people realize they're not alone and that we can have smart conversations about this, right? And so, the other side of gun violence, we know that teens, particularly youthful men, particularly men of color, for the last 2 decades, this is the primary cause of loss of life, right? Homicides and gun violence against one another. And so when we think of peaceful resolution or kind of why people find themselves in these situations, there's a whole opportunity for us to engage in communities that, um, may not have access to creative outlets, right? If the kids that can count in kilos have to do their summer job carrying a gun, that might be a scary situation, right? So, how do we get these kids, young adults, and teens into safer sort of situations? And not only that, right? There's this other side of, okay, well, we have small children, pediatric children who accidentally find the guns that we keep in our homes that are not secured safely and kill themselves. And every year it happens. And if we could just get that number to zero instead of hundreds, that would be awesome. And there's this, acronym out there about smart gun storage. And so essentially, you know, you want to make sure that you talk to people in your community about securing the guns in your home. You want to make sure that if you keep a gun in your car, your truck, or on your bike, right, that it's kind of secured in case somebody else happens to find it while you just run into the convenience store for just a moment. You want to model responsible behavior around guns. We know that um, it is important to be able to protect yourselves because it's just the reality of the world that we live in. However, you want to make sure that if there are small children around in your home, that these items of curiosity are explained so that they can really understand the impact of them. And when you think a little further about this SMART acronym, we already talked about the S in securing your weapon, the M in modeling responsible behavior. There's an A for asking about how guns are stored in the homes of those that you go visit, right? So,
Mhm.
so many children that get harmed because they're playing with the guns at their friend's house or their family member or whoever's babysitting them. And so it's really helpful just to kind of raise the question about, how people store their guns. Assume everybody has a gun. Just assume that everybody has a gun. We will hope that people will start to store them in a safe way. And then the R of the acronym is to recognize that guns are amazingly present and they are the number one cause of death from suicide, right? It's not violence against other people, it's people using guns to hurt themselves. And then tell your peers to be smart. That's the T of smart, right? Talk to other people about it. I think we often are in silos, but if we remember to be smart and to secure our weapons, model responsible behavior, ask about unsecured weapons in the homes we visit, recognize the role of guns in suicide, we can tell our peers to be smart. And so there's a whole movement out there, and the Be Smart for Kids org, they have gun locks and other resources to help people to reduce the number of children that we hurt and harm.
What a wealth of resources in just our small talk here. I can't wait to read your book from cover to cover. And in the while we're talking about gun violence,
Lit- Literally, oh, sorry, I'm giving you my written copy, but that's literally the flow of the book, right? So there's a topic, and then
pictures.
there's a section of resources for every single topic
Oh,
that's in here. So want to do everything that I can, right, to know that my neighbors, whether you live in the same zip code as me or if you are far across the country, right, that we all have same access to opportunities and to live our healthiest life. So, tons of resources. Every chapter has a section of resources in the book.
yeah, that's perfect. That's exactly what I talked about at the beginning when I talked about health literacy and your ability to obtain information. That's exactly what you have done. And you have educated them. And through that education, they'll be empowered to ask questions and navigate the system. Gun violence is a very serious topic, often associated with anxiety and depression. And so we have dedicated a show to all three of those things: anxiety, depression, and suicide. So I do invite you to go back and watch that episode with our in house trauma therapist, Kelsey Wilson. We'll put that link in the description box. At the time of this, yeah, I'll just leave it at that. You can click the link on there and you can schedule an appointment with her. So, as we close out, who is the book written for? Like, what ages?
Oh, I think honestly, listen, I am about real discussions and real conversations. And so when we look at who typically runs households and medical decisions, right, by far, women are more engaged in making sure that their families are healthy
Mm-hmm.
and that their children, their partners are healthy as well. And they encourage these people to get themselves checked out. We may not always take care of ourselves the very best. And so I think this language or the way the book is written um, will appeal, probably honestly, to a lot of women.
Okay.
However, I think the information that's in here appeals to anyone that loves people who want to have a healthy life, right? Whether it's really understanding the impact of heart disease and stroke, or understanding the challenges that our gender diverse loved ones have when they go seek health care, or the fact that people with physical or cognitive disabilities struggle and have unequal access to healthcare as well is huge. And so anybody that has a loved one that probably has been engaged in the healthcare system a couple of times, this book is for you.
Exactly. So when's it due? When can we make a purchase?
This week we are live. It is go time. So you can find the book in Amazon. You can find it from the publisher, KP Pub. You can find it on my website, drrubyjlong.org. And so we will be in brick and mortar stores soon. So it's out there. You just got to click a link and get it.
Oh, that's wonderful. Yeah, I don't know. I recently met the guy who owns Mahogany Books.
Yes.
So, are you going to be there?
No, I'm not. No.
Oh.
No. And I'm like, yes, I need to. There's a whole process of like, expanding my reach.
Yeah, and any way we can help you, please let us know when you come with your next book. You're welcome back on so we can hear about that chapter. We'll put all the resources that you mentioned, as well as how to connect with you in the description box. Is your website the best place for people to connect with you?
Absolutely. So drrubyjlong.org. drrubyjlong.org is the best way to get in touch with me. You'll find me on Instagram, Facebook, and kind of LinkedIn, all those places. And really, I hope to grow a community where patients feel empowered, they feel seen and respected. That's the restorative part of the book, so that we all find ways to live our very best lives.
Well, Dr. Long, it's been a pleasure to hear about your personal journey, your passion and love for the community, and these resources that literally will save lives.
Yay! Thanks, Dr. Madison, for having me.
We'll be praying for you as you continue to push out your book. We love seeing how well you're representing. You're checking a lot of boxes right now. And while we do talk about health literacy, we also promote professional practice, and we love entrepreneurship. And so we wish you all the best in this, and we hope it just goes beyond your greatest imagination.
Yay! Thank you so much.
We thank you. Remember, everyone, you can email us your questions and show ideas to tmi.melanin@gmail.com. If you haven't already, please subscribe to our YouTube channel and follow us on every social media platform. Say hello in the comments when you get there. Especially rate us on the Apple and Spotify podcast, and share the show with your friends. At the time of this filming, we release new episodes on Sundays at noon Eastern. And if you're a diehard subscriber, you know that we release a podcast at 5 a.m. for our night shift friends, so that they have something to listen to on their way home, that we don't forget that they exist, and that in our friends on the day shift, they can listen before they start their day. Yeah, we thank you everyone for watching, and we'll see you next time. Thank you, Dr. Long.
Thank you.